we have a microbiome on our skin, right? So that's part of the normal flora. We have some bacteria that are just part of us. We have bugs in our gut, we have bugs in our mouth, we have bugs on our skin and on our eyes. Unfortunately, that's the truth. So we are full of bugs. But when the balance or that, when we have a dysbiosis, which is a term that's used a lot in gut dysbiosis, when you have an imbalance of the gut microbes, but that can actually happen on the skin, which is what we see in rosacea patients. We see imbalance of the skin microbes, and that is why we see higher prevalence of blepharitis, specifically like Demodex, which are mites. So we can think of it as like, okay, overgrowth or overpopulation of different types of microbes. Again, you can have like staph, as a common one. You'll see Staph aureus, and then also on the other hand, very common one is Demodex, which are mites. So again, these are there are two different types, Demodex brevis and Demodex follicularum. So both can be associated with blepharitis with ocular findings, but a lot of times we see the follicularum. And patients get really freaked out when I tell them they have mites on their lashes. One of my favorite things to do, that's really maybe it's a little bit mean, because I pull an eyelash out and put it under microscope, and patients actually see their Demodex, which really has improved compliance with my treatments, because patients freak out. Even if I tell them we all have this, they don't hear that. As soon as they see little bugs, crawling around and dancing on off the lash that I pulled off their eye, they just say, I'll do whatever you say to get rid of these. So that's really, kind of, you can have different kinds, but ultimately what the traditional treatments have been to really address the ocular hygiene and kind of use certain treatments to clean the lids properly in the morning, at night. But my area of interest is really the correlation that we have with the ocular microbiome and gut microbiome.